name is Ansley. So what if I were to tell you that your definitions of depression and anxiety are not as complicated as depression and anxiety are? Many of you guys filled out that survey, and your definitions of depression and anxiety only scratch the surface of all of the complexities of depression and anxiety. Many people suffer from depression and anxiety, whether it be close friends, family. If you think you don't know anyone with depression and anxiety, that's a lie, because I do suffer from depression and anxiety. There is just so much more to depression and anxiety than most people know. And my goal with this speech is to give you a better understanding of both depression and anxiety, and also to give you some long-lasting effects that can come from depression and anxiety. Merriam-Webster defines depression as low in spirits, sad, especially affected by psychological depression. In a TEDx talk given by Megan Shinnick titled "The Truth About Teen Depression," she differentiates the difference between depression and sadness. Sadness is an emotion that comes and goes. Depression is a feeling that is always in the back of your mind. MayoClinic.org states some of the symptoms of depression can be irritability, blues, unexplained physical problems like headaches, fatigue, and reduced appetite. Depression can manifest in a couple different ways. The most common ones are sadness, emptiness, or anger. Harvard Health Publishing, which is a media and publishing service for Harvard Medical School, wrote an article called "What Causes Depression." In that article, it states some of the neurotransmitters that can cause and affect depression. One of those is serotonin. Serotonin is in charge of regulating sleep, mood, and appetite, and also inhibiting pain. People with depression have been thought to have low serotonin or low serotonin transmission. In that same article, it points out the parts of the brain that are affected by depression. That includes the amygdala and the hippocampus. The amygdala is part of the limbic system, which can help regulate mood, and the hippocampus helps with long-term memory. So, moving from depression onto anxiety. Anxiety is different from depression in many ways, yet depression and anxiety usually go hand in hand. So, many people feel scared or nervous when performing or presenting a speech, and that's totally normal. When you're feeling anxious or nervous, that invokes your fight or flight response in your brain, and that's totally normal. People with anxiety disorders, the fight or flight response in their brain does not work properly or does not shut off. MayoClinic.org states that some of the symptoms of anxiety include having a sense of impending doom, restless sleep, fatigue, increased heart rate, and gastrointestinal issues. In that same article, "What Causes Depression?" it mentions the neurotransmitter norepinephrine. Norepinephrine is in charge of constricting blood vessels and raising your blood pressure. And this can cause the effects of anxiety to worsen. In that article, it also mentions the amino acid gamma-aminobutyric, and that is thought to lessen the effects of anxiety. People with anxiety may have increased norepinephrine or not enough gamma-aminobutyric acid. In that article, "What Causes Depression?" it talks about the hippocampus being one of the main places for anxiety to happen. The hippocampus is in charge of registering fear and long-term memory. So for example, if you are bitten by a dog as a young child, your hippocampus is going to register that fear and store that in your long-term memory, and so you will most likely be anxious around dogs later in life. So not only do depression and anxiety cause many problems with mood and emotion in the moment or within a short span of time, but they are also linked to several different medical issues. For example, anxiety can lead to heart problems, chronic pain, and thyroid problems like hyper and hypothyroidism. Depression and anxiety can both cause a loss or increase in appetite, which can cause eating disorders later in life. Because of these long-lasting effects, there should be some better treatments placed. In the 10X talk Megan Shinnick gave, she talked about a bridge program that her school placed. What that bridge program did is it took kids who had been in mental hospitals for a couple weeks, and instead of sending them straight back into their academic careers full force, it focused more on their mental health and helped them get back to a state of neutrality and being able to function in school. So, in this speech, I went over some better definition of depression and anxiety and some of the long-lasting effects of depression and anxiety. Depression and anxiety can be so complicated, it comes down to each individual chemical in each individual brain. I hope that you guys have a better understanding of depression and anxiety and are more aware and can help each other out.